Neymar suffered a knee injury 2 nights ago where he fell to the turf and he actually had to be stretchered off. There was a lot of speculation at the time as to what was going on with this injury. Unfortunately, it looks like sources are reporting one of the worst case scenarios. They're saying that he has suffered an ACL and a meniscus tear and he's due to miss significant time. The position that Neymar's leg went into is something known as a dynamic knee valgus, and this can be very risky for those structures. And since some people may not be too familiar with that position and why it's risky for that anatomy, I want to go ahead and focus on that with this video. Ladies and gentlemen, welcome to my channel. If you're not familiar with me, my name is Nick Gallo and I'm a doctor of physical therapy. With my channel, I take a look at sports injuries and I explain them so that they're a little bit easier to understand. I also go to the pertinent anatomy for those injuries, as well as what that person should expect when in rehab. If you like this content and you want to see more of it, please hit that thumbs up and subscribe to the channel because I will be making more of these videos in the future regarding sports injuries, rehabilitation, and other physical therapy related content. Also, if you have any experience with these types of injuries, please go ahead and comment in the comment section below. Now we can see right here on the injury video that as Neymar is running, he's going to plant awkwardly. And as he does this, the inside portion of the knee is going to cave inwards with those toes pointed outwards. Here I have a model of the knee, and so the knee is comprised of several long bones that are going to come down and form the knee joint. The first one being the femur or the thigh bone that's going to come down and form the top portion of the knee. Then as we look at the bottom here, the tibia bone is going to come up and form the bottom portion. And then as we go towards the outside or the lateral portion of the lower leg, we also have the fibula bone. There are 4 ligaments that basically contribute to overall knee stability. The first one and pertinent one for this injury is the anterior cruciate ligament, or the ACL for short, located right through here. As we look on the inside portion here, we have the medial collateral ligament, or MCL. We go towards the outside here, we have the lateral collateral ligament, or the LCL. And finally on the back here, the posterior cruciate ligament, or the PCL. And also there are 2 more important structures that are located in between the tibia and femur bones. They are the medial and the lateral meniscus. You can think of these 2 pieces of fiber cartilage essentially as shock absorbers between the tibia and femur. So I mentioned the term dynamic knee valgus, so let's go over that briefly. Now, when we talk about a valgus force, this is when a person is getting a force coming from the outside, going towards the inside portion of the knee. And anytime that does that, you can see the model here, that's going to stress all of those structures medially. It's also going to stress that ACL as well. When we talk about a dynamic knee valgus, this is where a person's lower leg is going to be externally rotated, with the femur internally rotated. And as I do that, you can see that it is also implicating that ACL even more here. And this is because the ACL has a big function of rotational stability of the knee. So anytime we're getting a rotational force going through the knee, that can absolutely affect the ACL. You can also see here that it's going to affect the meniscus that's going to move on this model, as well as the MCL. Another big function of the ACL is to prevent forward motion or anterior translation of that tibia bone. And so there's actually another angle of the injury right here in slow motion that as Neymar plants, you're going to see that tibia, what looks like, shift forward briefly and then come back up. If that is in fact what is going on in this video, then it looks like he's already having significant knee laxity in terms of the ability to prevent that anterior translation, which based on observation would make us think that he's dealing with an ACL rupture. This motion is actually very consistent with some tests that we can do to determine basically if someone is dealing with an ACL tear. The first one is known as a Lockman's test. Essentially what we're doing in that test is we're stabilizing the person's femur and we're pulling on that lower leg forward, and we want to see if that person has any laxity and or pain. We go ahead and compare that to the other side, and if there is significant laxity, then that makes us believe that the person is dealing with an ACL tear. There's another test called the anterior drawer test. It's basically a similar type of test. All you're doing is stabilizing the top piece in the bent position, and you're pulling on that bottom leg. Sometimes these tests won't be accurate because somebody has a lot of muscle guarding, so that tibia may not shift as much. So the gold standard, of course, is the MRI, which is of course what Neymar had, which has confirmed the ACL tear. We also know he's dealing with a meniscus injury because both of those can be implicated in this dynamic knee valgus. Something else that can also be torn in this is the medial collateral ligament. And they call this a terrible triad injury because anytime you're getting that rotational dynamic knee valgus going through the knee, all 3 of these structures are at risk of injury. Fortunately, in this case, the MCL was spared. Now there's a grading system for these ACL injuries, and usually with grades 2 and 3 are where we're only going to see some of that instability. In a grade 2, that's where you're getting partial tearing, and finally in a grade 3, that's where you're getting a full rupture. Usually in that grade 3, you're also getting surgical intervention, and as of right now, it looks like he will have surgery. So unfortunately, once again, they're confirming the worst case scenario here, where essentially he has a full rupture of the ACL and he should undergo something known as a full ACL reconstruction. Obviously, with a full ACL reconstruction, he's due to miss several months. One thing that can complicate that a little bit more and maybe delay it a little more, in fact, is the fact that he's dealing with a meniscus tear. So one thing that can be done in a meniscus tear is known as a meniscus repair. And because the meniscus essentially is providing cushion between those two bones, this means that there's going to be a weight-bearing precaution for a significant number of weeks just to allow that meniscus to heal. We don't know exactly if that's going to go on in this case, but just know that that's something that can also occur and essentially delay things a little bit longer. A big portion of rehab initially is going to make sure that essentially we are protecting the graft. So we don't want to push anything too fast here. We want to make sure everything heals properly. Then of course, we're restoring range of motion. And finally, a big piece of rehab is doing a lot of single leg stability exercises to prevent that internal caving or that dynamic knee valgus in the knee. So anytime we get somebody in the clinic, we're doing a lot of single leg strengthening. We're doing it in single leg stance positions, single leg press, things along those lines. And finally, when it's appropriate, you can start working in sport specific movements. Usually that's about the 9+ month mark. So essentially we're gonna have to wait and see if there's any more details provided regarding his surgery. If I happen to hear any updates regarding his case, I'll be sure to update that in the comment section. Also, if you happen to hear anything, please feel free to update me as well. So we wish Neymar the best of luck moving forward. Unfortunately, this is a lengthy recovery time, but nowadays with rehab and surgery, players typically do tend to make a full recovery. If you like this sort of content, I'm gonna go ahead and link another playlist of mine so that you can watch similar videos talking about knee injuries. Once again, thank you so much for tuning in today, and I'll see you next time.